Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Prasad, Pediatrics and Emergency Medicine Physician affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. Today, the theme of our Health Talk is Saving a Heart Attack Victim. Joining us as our guest speaker is Mr. Hari Prasad, he is the patient, Dr. Bala Prasad, the first responder, Dr. Amish Prasad, the ACLS transport cardiologist, and Dr. Mahjoub, and he is the interventional cardiologist. So this is a very true story, and today I will be sharing with you all this what happened. So first of all, I like to introduce all of them. Mr. Hari Prasad, I'm very lucky to have you because you're the survivor from the heart attack.
Thank you very much for giving me this opportunity here.
Thank you. Dr. Prasad, I'm very happy to have you because even though your specialty is orthopedic surgeon, you did well as a first responder. So I'm lucky to have you.
I'm very happy to be here.
Amish, you are like my other son, okay? I have seen you since you were a little boy growing, and now you are a cardiologist, and I'm very lucky to have you because you were there with your dad.
Yep, thank you for having us.
Okay. Dr. Mahjoub, I'm very happy to have you as a cardiologist because you saved our friend, right?
Thank you. Thank you,
Okay.
Doctor.
So, Mr. Prasad, we were very privileged to attend your 50th wedding anniversary at a big hall, and the function was great. We were all having a wonderful time there.
Well, thank you.
Now, you went to the podium to welcome all the guests. Please tell us what happened.
Okay.
What you felt.
We were celebrating our 50th anniversary. After I welcomed all my guests, we were dancing. I was dancing with my wife, and it was a slow dance. And after I finished dancing, I felt a slight pain in the middle of my chest. Okay. So I sat down, and I thought maybe I have some gastric problem and so on. So I took a sip of water, and still I was feeling pain. So I asked my daughter-in-law to give me some food. I felt tired or
right,
weak.
You were feeling tired,
yes,
you were
yes,
working whole day and excited.
That's true.
Yeah.
So she brought me some food, and I ate some, but still I was having pain. And then I felt hot. So I said, well, maybe this hall is no, it is hot,
crowded,
getting too crowded here. That's
okay.
true. So I took off my jacket, and then I went outside in the fresh air. Still I was feeling hot, and I was feeling a little bit dizzy, just out of control. So I talked to my friend. I said, well, I'm not feeling very good, so let me sit down somewhere. So he said, well, let me bring a chair for you. So somebody went inside and was bringing a chair. Meanwhile, I was walking towards the chair, and I lost myself completely. I don't know what happened.
You felt very dizzy.
Very dizzy.
Yeah. So then, there was a big commotion among all our friends
Yes.
and kids. So Dr. Prasad happened to be there. Somebody called him. Dr. Prasad, will you please tell us what happened then when you saw him? What is the first thing you did first of all?
Well, I was inside the hall. One gentleman, one friend of his, my acquaintance also, he came and told me that something is happening. Come on out, take a look.
Okay.
So I went out on the deck. Here he was, sitting in the chair. He was barely breathing, and he did not know what was going on.
Okay.
So first thing I did is I picked him up, lay him down on the floor.
Raised his leg.
First lay him down on the floor, opened his jacket button, his shirt button, and asked one of the other guests to lift his leg up. One hand, as soon as he went on the floor, my left hand was on his sternum, and my right hand was on his carotid.
That was
and
great.
then he came, and I kept on asking him, check the pulse, check the pulse. I could feel the pulse myself.
Good. Great.
So no time I lost the pulse, and no time I saw him not breathing.
Oh.
But I have to be prepared for either or both to happen.
So, Dr. Prasad, you have brought some interesting videos. So, we are going to project the videos, and could you please just talk a little bit about the steps of CPR in case, thank God it was not needed. So in case, what you have done? I know you recently recertified.
Yes, but I will go back to a situation where I had to give the CPR about 10 years ago.
Right.
When another friend of mine, he had a complete cardiac arrest, and very similar situation. We were all at a party. He was sitting next to me. Before anybody knew, he passed out. First thing I did again, I lay him down on the floor. Another guy lifted his leg. I told somebody to call 911, and then open the shirt, open the jacket, open the belt. And at that time, I could not check his pulse. So there was another physician. I told him to put your hand on the neck and tell me when you feel the pulse. He did not feel the pulse in the beginning. I started with the cardiac massage, and then I think about 30 seconds later, he said that he is feeling the pulse, and the pulse came back within the minute. What I did in cardiac massage is put my left hand on the lower part of the sternum. I am making it sound as in layman term as possible.
Right. That's the first responder.
I put my left hand on the lower part of his sternum.
There are some pictures also, Dr. Prasad, if you want to see those.
That's the one.
Yeah.
Left hand,
the one
on the
you
lower
brought.
part of the sternum, heel of the right hand on the top of the left hand, and you start to compress the chest. 100 compression a minute, 30 compression at a stretch. After you have done the 30 compression, I remember those things because I was recertified 2 months ago. 30 compression, you have to give at a stretch, no stopping, then 2 puffs of air for the mouth to mouth. Then you go back to the compression, and you keep on repeating it as long as you need to, or till the EMS comes. In that other case also, the EMS came, but the gentleman had the pulse returned to him before the EMS came.
So that was great, Dr. Prasad, being an orthopedic surgeon, but here you are playing the role of a bystander. What your instinct said.
Orthopedic surgeon, being an orthopedic surgeon has nothing to do with it. Nothing I did that relates to my training or work as an orthopedic surgeon. It has to do with my CPR training that I took, and natural instinct. I don't know why I got up and I did what I thought I should do, and here we are in both situations.
Such a good outcome. Such a good outcome. Our friend is here sitting.
That's true.
Sitting and doing great.
If you ask me what instinct made me do what I did, I have only 2 things to say. He knows.
God knows.
He knows. And I will have to ask a psychiatrist what instinct made me do what I did. But I think I just did the right thing that I thought.
But I think you did great. Being an orthopedic surgeon, like as a bystander, lot of credit goes to you. Now, Amish, I'm calling you Amish first name because you're just like my other son. I have seen you growing since you were a little boy. Being a cardiologist and seeing your dad in that stage, could you comment how you felt and what was your instinct?
Yeah, absolutely. So the first thing that happened, we were all at the party, like everyone has said, and I was actually walking outside, and then in that midst of that time period, some people mentioned, okay, something's going on. Your dad is actually not feeling very well. So as I arrived, Dr. Prasad was also there, and he was actually still standing up, and we both kind of grabbed him and said, okay, let's get him to the ground first.
Right.
And he was still, he actually, to us at that time, he was less complaining of chest discomfort and more saying that he was feeling dizzy and just wasn't feeling right and feeling very hot. And when we saw him at first, he was very sweaty, which as a cardiologist is one of those telltale signs.
The red flag of
one of the red flags is something may be going
emergency
on.
medicine,
Right,
right.
and especially with dizziness. But he had a pulse. One of the things that we made sure of, that he was always awake and he was talking to us and just keeping him more alert while he was there. But because he was feeling dizzy, another thing that we worried about is stroke-like symptoms.
Exactly.
I mean, obviously we want to make sure it's not the heart, but could it also be a stroke?
Definitely, that's the #2 cause for all this.
Absolutely. So we had him move his arms, move his legs, kind of speak to us the entire time. And then actually after a little while, after maybe 5-10 minutes on the ground, first of all, when we first arrived, immediately we said, someone call 911. Just to be on the safe side, always in the back of your mind, you think worst case is they come and they say everything's okay, but at least you have the paramedics there ready to go right away. But after about 5 minutes, while we were waiting for EMS, he actually sat up, and I think he actually burped a little bit and said, okay, I feel better. But again, from a heart standpoint, a lot of the symptoms are, they only last for about 5-10 minutes. They go away, and then they may
like
come.
a silent MI.
Right, and they may go away and come back and go away and come back.
Right.
So when he sat up, even though he was ready to go back to the party and dance or whatever, we said, no, let's wait for EMS to arrive. But in the meantime, he was awake the entire time, and his chest discomfort that he was having had gone away. But once EMS arrived, they checked him out. They got vital signs. Again, made sure he was awake and alert. And at that time, they actually did a 12-lead EKG right there at the party, connected to his chest, and looked for his rhythm and any EKG changes.
So let me interrupt you for a second. I could see the rhythm, and I knew what was happening. He was infarcting. But then, so many people around, I wanted to keep everybody quiet. So I said, everything is okay. So then you transported him to the...
Yeah, as soon as I saw, and the paramedics, they agreed also, but as soon as I saw his EKG
you knew
there, I said, okay, he needs a cardiologist. He needs to.
We all saw it together.
Yeah, we all saw it together.
Yeah,
and he said, okay, you need to at least go to the emergency room. If not, go to the cath lab.
So, Amish, you brought some nice videos. Would you like to comment on those?
Yeah,
I know you're a cardiologist.
Yeah, we just kind of brought some generic pictures of what normal pictures should look like of the heart, of arteries, and these are procedures that I thought. This
right
is
and left coronary artery.
Right, and this is a procedure, a heart catheterization, where we look at the arteries directly, which I thought that he would need at the time of the party, or at the time of at the time of his symptoms after the party.
Right. Okay.
But the most important thing that we did, I think, after we saw the EKG, we let the ambulance know. Okay, he needs to go. We made sure that he got aspirin in the ambulance, and even at the party, we made sure everyone stayed calm. And
excuse me, could you comment on the picture? This is a very nice picture about how the plaques are.
So this is a picture showing evolution of coronary arteries, or just arteries in general, from normal, and then anytime anyone has high stress or high blood pressure, high cholesterol, it evolves into a plaque surrounding the inside of the artery hardens, and if at any time that plaque were to break off or become unstable, it can actually break off and go further down the artery, almost like a pipe. And if it breaks off and causes a blockage suddenly, especially, it can actually cause a heart attack.
Right. So Dr. Mahjoub, he already contacted you before Mr. Prasad reached the emergency room. Could you please highlight our viewers about what happened afterwards? How he was handled?
Thank you, Dr. Prasad, for this invitation. I'm glad to be here. I'm glad to see that Mr. Prasad is doing well. I think he did well because it was a combined effort of everybody.
Right.
I mean, he's lucky that he is in a party surrounded by physicians, by his son, who is a cardiology fellow. So he got a prompt response, and it was obvious that he was having a high-risk heart attack. He occluded his vessel, and he was having ventricular arrhythmia. Mr. Prasad arrested at the party
Okay.
And when we met at the hospital and we took him to the cath lab straight, he had another arrest,
Okay.
and he was shocked out of it. So we knew that we were dealing with unstable heart attack victim. The I think all this response that happened from the scene caused this happy ending. And I want to give also thanks to the ambulance who brought him in a timely fashion. Thanks to the ER staff at Clinton Hospital as well as the cath lab team, because we moved fast because we felt that we needed to rescue him quickly. So he was taken to the cardiac cath lab, and that's what we usually see. We see a heart attack. In heart attack patients, we see the vessel is occluded, and all we have to do is to go in and restore the flow in this vessel, and then everything quieted down, and there is no further arrhythmia. So he was taken in a timely fashion to the cath lab, and we were able in a timely fashion and in a quick way in establishing the flow back in this vessel. And after we established the flow back, he had no further arrhythmia, and his course was very stable after that, and he was discharged.
So that was very
shortly.
good. Do you see this kind of story in your clinical practice all the time, I believe?
Well,
How often you see encounter this kind of?
Most of the heart attack patient develop chest pain, shortness of breath, weakness.
This was asymptomatic.
And they seek help. They have time. They can call an ambulance. They can call a friend, and then we take them to the hospital. But in a case of a cardiac arrest, which is a certain percentage of heart attack patients, they present as a sudden cardiac arrest. Those are the high-risk one. They need to be in an environment that support them initially. The most important thing is what happened at the scene. Dr. Prasad did what should be done, and Dr. Amish also did his job. So the first few minutes are crucial, because the heart muscle cannot take a long-standing blockage for a long period. The heart muscle will die, and there will be a bad outcome. So the most important thing is to respond at the scene by somebody, and he was lucky that he was in a party surrounded by physicians. So that's what led to this good outcome.
Yeah. So the takeout message for our viewers is to be prompt.
I think
be prompt, and
the takeout message is
the chain of survival is call 911,
yes.
and then
if you experience any symptoms of chest pain, shortness of breath, diaphoresis, weakness, do not wait. Just call somebody, ask for help, and because the process moves fast, and you have to quickly get to the hospital, so we can actually do something to save your life.
How many minutes? I forgot now. I know with the emergency medicine background, I used to do all those, so often. How many minutes of hypoxia can the brain survive? Isn't it like that? 6 to 8 minutes?
Yeah, I think the brain cannot take a prolonged period of hypoxia.
Right. More than 4 minutes.
Probably, in that range, you need to restore the blood flow to the brain, and as well also restore the blood flow to the heart, because in his case, restoring the blood flow to his vessel was the main factor in quieting down his ventricular arrhythmia.
Okay, and doctor, you brought some images there, so. And I know. So could you comment on those for our viewers?
This is actually Dr. Prasad's heart.
Okay.
So you could see on the
left coronary artery.
Yeah, this is his left main, and it gives 2 branches. And you could see, if you look at around like 1 o'clock, you see a missing vessel. This is the first picture that we took.
Okay.
And this was a diagonal branch of his LAD. And the next image, if we can show this image, this is when we go in, and you could see the wire. We pass a wire into that artery, and we inflate the balloon to restore the blood flow. And then if you go to the third image, you could see this artery showing now up, like around 2 o'clock, you could see this artery is back, and the flow is restored to this vessel.
Good circulation now.
And the circulation is back to normal, and that resulted in stabilization of his ventricular arrhythmia.
Okay. And doctor, how long this whole procedure lasts at the cardiac lab?
Well, I think the process when he gets to the ER, and we call the cath lab team, and we usually respond in a timely fashion. And the process when we took him to the cath lab and until we actually got him back, it was a matter of maybe 15 minutes. We were able to restore the blood flow. So the process goes fast. I remember I've done cases like this where I was able to do it in 5 to 10 minutes. But my time is just part of the overall duration from the onset of the chest pain. Right. Remember, that's the time when the injury starts. So when Mr. Prasad experienced his symptoms is the onset of his heart attack. So we count the time from that moment until we actually establish the flow. So all the efforts of his friends, the ambulance coming in a timely fashion, will be counted as the overall time between the onset of the heart attack as well until we establish the flow back in this artery.
So that was very good. You did a wonderful job saving our friend's life. And now after that, you advise them to go through the cardiac rehab?
Yeah, well, Mr. Prasad is very motivated, and he comes, and he already read the book about the rehab, and so I didn't have to explain to him anything about it. We send all our patients with heart attack to the cardiac rehab, which is a lifetime fitness, but monitored. So they not only an exercise program, but they talk to them about diet, sticking to the medication, healthy lifestyle, and data showed that people who participate in the cardiac rehab, they have a better outcome compared with patients who do not participate in a cardiac rehab.
Because it's a continuous exercise.
Yes.
And as a last question, since my program, I do this all, it's a community outreach program. So what are your advices as a cardiologist? Increased awareness of the heart attack symptoms?
Well, I think the process starts in the prevention first. Right. How do you prevent something like this? So this goes into having a regular checkup with your primary care physician. Just make sure your blood pressure is fine, your sugar is fine, your cholesterol is fine, and you eat, you have a healthy lifestyle, and you exercise on a regular basis. This is kind of prevent this from happening. But if you ever experience any symptoms, do not go into a denial phase and say, this is what this is what we see most in common practice, that patients, especially the young people, they go into this denial phase that, no, maybe this is a stomach, maybe it's an ulcer, maybe it's a reflux. Do not delay seeking medical help. Whenever you get symptoms, just call for help. At least call your primary care physician. When you're in doubt, go to the emergency room. Do not risk your heart.
Okay. As a last 1 minute question, Dr. Prasad, as a first responder, what would you say?
Most of the time, there is not enough time to call the trained first responder team, the EMS or fire department. Most of the time, they will take 3 minutes, 5 minutes. There has to be somebody in that group of people that you are with, or your spouse or your son or anybody who has the idea of CPR. It has nothing to do with my being an orthopedic surgeon or him being a cardiologist.
Increased awareness.
What helped me most that I have taken the recertification exam just 2 months ago.
2 weeks, no, 2 weeks ago.
2 weeks before this, 2 months from now.
And that made you a pro, Dr. Prasad.
So I knew everything, what to do, and I did. And here, by the grace of God, everything turned out okay.
Good. Now, Amit, one minute question from you. Could you give your output, and what would you suggest the public
So I think
as a cardiologist, as it's being emotional, you know, because he's your dad.
yeah, absolutely. I think like Dr. Prasad and Dr. Mahjoub mentioned, not ignoring the risk factors, not ignoring the signs and symptoms of heart attacks, especially if someone is having chest discomfort, difficulty breathing, just to recognize that. And also noticing the warning signs leading up to it.
Right.
If you notice you can't exercise as much, you have more difficulty breathing with just daily activities. Just not ignoring the symptoms and definitely getting attention.
Because I was standing there listening and watching everybody in action, you know, I knew what is happening, and I know there was a lot of emotional, you know, emotional things. But then the most important thing is for everybody, for our general public, you know, to increase awareness of the symptoms and then act accordingly, right?
Right.
Yeah, so that's very good. Now, back to you, Mr. Prasad.
Okay.
Give us your last 2 minutes.
Yeah, first thing that since I have the actual experience now, and Dr. Mahjoub said that I was in the denial mode first.
Right, denial.
And the reason is that I am active in the past, and I control my diet. I have my blood pressure was controlled, my cholesterol level was under control, and everything. So I didn't expect that it will happen to me, actually. Okay, so I thought that maybe it is just like a acid reflux or gas or anything. Okay.
Okay. Thank you very much for sharing your story with us. I like to thank our guest speakers for joining me today, Mr. Prasad, Dr. Prasad, orthopedic, Amish, cardiologist, and Dr. Mahjoub. And I like to thank our producer David and our camera crew for helping me produce this wonderful, interesting video. Thank you again.
Thank you.
Thank you.